All right. Well, good morning, everyone. Happy Wednesday. Happy hump day. I know many of us look forward to Wednesday. It's always a good feeling. You feel like you've made it to the middle of the week. And especially during this time of COVID-19, where things are not in their usual rhythms and routines, it's nice to know that we've made it at least halfway through another week. So welcome to today's chamber program. The U.S. India Chamber has been hosting a number of webinars throughout these last several weeks. We're going on our 6th week now, webinars 3 times a week, showcasing various initiatives throughout the community and also providing our business members with resources and access to thought leaders during this time to kind of help our businesses weather this business disruption that we've all been experiencing. But today we have a very special program, and that program really is an opportunity for us to understand how we as the business community and the broader community can engage with our local communities to support them during this time. As we know, unemployment rates have hit all-time highs for this decade. We also know that the economy has not been doing well. Many businesses aren't sure whether they're going to be rehiring anytime soon. Employees have been furloughed. So there are a lot of families that have been affected by this virus, unfortunately. And we're not sure exactly when things are going to sort of quote unquote return to normal. So joining us today, we have a number of nonprofit and experts and community leaders who are going to be walking us through how we can engage as the community with supporting our fellow citizens and helping during this time. So if you have a few spare dollars or some time, they're going to be sharing with us how we can engage. So with that, and without too much more, I want to introduce Erica Yeager. Erica is the head of philanthropy at the North Texas Food Bank. And Erica has been a friend of the chamber for many, many years in various capacities, but she's been leading the initiatives at the North Texas Food Bank for fundraising. And as many of you may know, the North Texas Food Bank is the largest food bank in North Texas, providing food to thousands of families throughout the year, not only during this time, but in general. And I know that they've ramped up their efforts. So joining us, Erica, I'm going to hand it over to you. Give us an overview of just what the North Texas Food Bank is seeing on the ground. I know you have some slides for us, so please walk us through what is happening during this time.
Yes, thank you, Neil, and thank you everyone for taking a few minutes this morning. I'm excited to share with you a little bit about what the food bank has been experiencing since the onset of this pandemic. And I thought the best way to do it was to give you a visual representation. So you are looking at the outside of our Perot family campus, which is in Plano. It's strategically located within the 13 counties that we serve. But what I wanted to point out here is the sculpture of the big silver X. That piece of art is titled Lulu May's Mark. And for those of you that aren't familiar with the story, Lulu May is the mother of the late Ross Perot and Betty Perot. And during the days of the Great Depression, those that were hungry, that were walking by her home, placed a chalk mark X on the curb to indicate that that was a home where they could receive a meal. So we know that during these uncertain times, which are many economists are comparing to the days of the Great Depression, that mark still gives so much hope to those that are seeking food assistance. So this is a view of what's happening inside the facility. This photo was taken a couple of weeks ago, actually mid to late March, but we are running up to 5 different production lines in our facility on a daily basis, preparing up to 60,000 emergency family meal boxes to serve the increased need. And I'll talk a little bit about what that need looks like later on. But I wanted to point out here that we have completely redesigned our production model to align with a new distribution model. We realized early on that most of the pantries to which we provide food are set up as client choice pantries, and that wasn't going to work in these days of social distancing and congregating. So we are kitting everything into boxes for a low to no touch distribution model, whether it's through our pantries or through our mobile distribution spots. But you'll take note here that our workers were taking great care to social distance. I know Sachel's going to talk about the shift model, but for the first few weeks, we were using those that were displaced from the restaurant industry to help pack these boxes. And this is Marco, who is one of my favorite shift workers, who is a bartender who had lost his job early on. But we noticed that those from the restaurant industry really knew how to hustle and helped us increase our output drastically. So the view has changed. This is a snapshot I took yesterday, and you'll notice all the workers in military fatigue. That's because on April 4th, 270 members of the Texas National Guard were deployed to come assist the food bank with the increased need and demand that we were seeing. So this allowed our Shift Smart workers to be redeployed to other nonprofits in need, and it gave us some assistance, not only in the production facility, but also out in the field. We've got members of the National Guard manning our mobile distributions. They've been deployed to some of our partner agencies. They're driving trucks, and they're working in our warehouse. But you can see they are still actively packing 60,000 boxes weekly. We were able to amplify production because of the great need, and have opened up a second facility. So this is a warehouse that has been donated to us about 10 minutes down the road, where we're doubling our production. So this was a picture taken yesterday as well. But I wanted to give you a glimpse of what we're packing in these boxes, just so you're aware. We're putting 25 to 27 pounds of shelf-stable food in each of these family emergency meal kits. Really high-protein, nutritious items from the whole wheat, rice, pasta, lentils, peanut butter, canned fruits and vegetables. Each box provides about 21 meals to the recipient. Now is probably a good time to talk about inventory challenges. I'm sure you've seen the news headlines about the impact of this virus on the supply chain. For the first time, the food bank is having to purchase these products. Normally, about 80% of our food items are donated from our retail partners. But due to a change in consumer behavior, we were experiencing a lot of panic buying. Our retail partners are having to purchase this food as well, which means not only are we buying it, but we're now competing against the grocery stores for the same product, and suppliers are putting caps on the product. So we just received word that FEMA is going to be providing about 5.9 million pounds of food for us to better serve those who are hungry. But I know there has been some concern about the inventory. So we're supplementing the shelf-stable product with a 15-pound box of produce. This week on the floor, I've seen avocados, oranges, apples, eggplant, mangoes, but we've got a distribution this afternoon at University of Texas at Dallas, where we're taking 750 boxes of fresh produce, because we understand there are international students that are struggling a little bit with food insecurity. So these are some of the boxes that we'll have on campus this afternoon. So you've seen the boxes. I want to talk about where they go once they leave our facility. So we're currently distributing through two primary channels. The first is through our partner agencies. We work with more than 250 partner agencies across the 13 counties. And then through our mobile pantry distributions. So this was a picture taken on March 20th at Williams High School in Plano. This is a regular distribution spot for us, where we normally distribute 300 boxes. On this day, we distributed 1,500 boxes through our new drive-through model, where cars would pull up, they would let us know how many people they had in their family, they would pop their trunk, and we load it in. So this is really the first indication on March 20th that we were dealing with something that we've never experienced before. Since then, we've been increasing our mobile pantry distributions to 2, sometimes 3 a day to accommodate the growing need. Our largest mobile pantry distribution remains at Fair Park. We're seeing about 4 times the amount of people come through. Last Thursday, we distributed 6,500 boxes, which served just over 2,300 families. And you likely saw some of the media coverage of the cars lining up for miles, many who got there 6 hours before the gates even opened. People were sleeping in their cars to make sure that they were in line to get food, because we have been running out of the boxes at each one of our mobile distributions. I'm happy to share on this day, we had enough boxes for everyone. But as of last week, we've distributed over 13,000, or we've served over 13,000 families through our mobile pantry distributions. Our second largest is at UNT Dallas. That's also one of our mega distributions, and we'll see that one tomorrow. So I wanted to share a little bit about ways the community is engaging. The first is always through financial support. We're able to provide 3 meals with $1, and that is always the best way to support the food bank. I wanted to share this note though, because we have received quite a bit of national media attention as of late, and we found that with every time we're on national news, we're getting support from people across the country. So this one was from a donor who lives in Idaho, who indicated she supports their local food bank, but saw the lines of cars on the news and wanted to support us as well. This was another touching note. Once the stimulus payments hit, we found that a lot of community members were sharing that stimulus payment, and I loved this. This woman shared she's on Social Security but has an adequate income for her needs and thought we could do more with it. So it really is heartwarming to see this type of support. I mentioned our inventory issues. Before we knew we were getting the assistance from FEMA, and it's actually an ongoing need, we partnered with WFAA to publish an Amazon wish list, which is currently up at ntfe.org/wishlist. And this details the very focused food items that we need for the emergency meal boxes that we're preparing. And we are updating that list on a regular basis based on our inventory levels. So we started this pandemic with shelves upon shelves of rice, thanks to USDA product, but we found that we were quickly depleting that inventory. So as of last week, we updated our wish list, and you're going to see more rice and grain products on there. So it's real time, and this is a way for the community to support us without leaving their home. I wanted to point out another way we are engaging volunteers. Typically, the food bank engages over 40,000 volunteers on an annual basis. And we knew people were feeling frustrated that they were at home and unable to be on the front lines and pack boxes and load the boxes. So we created a virtual volunteer experience where you can help us generate awareness of the need through your social media platforms and advocate for our work, because so much of what we're doing right now, we're depending on the federal, the state, the local government for waivers and resources. So now more than ever, we need our community members to engage in this capacity. So I'm happy to answer questions at the end of the presentation, but I wanted to express my gratitude for the support that we've seen so far from your community, and for allowing me a few minutes to share a little bit about what we're experiencing. the gratitude from those that we serve has been especially humbling. We have little contact with them because for the most part, they are in their cars with the windows rolled up, but we see the mouth thank yous, we see the prayer hands, we see the nods. So I wish this was something you could see because it really does give you a representation of what your support means for so many. One other thing I forgot to mention, Neil, you had asked a little bit about the quantities and the need, and I talked an awful lot about our mobile pantries, but our partner agencies, I spoke to one this week in Richardson who serves 200 families on a weekly basis. They're now serving 2,000 families on a weekly basis. We have distributed 11 million pounds of food in the past month and a half, and on a regular month, we're distributing less than 5 million pounds of food. So those are a couple of data points that really underscore how significant the need is in our community right now as a result of the furloughs and the layoffs. 40 to 50% of those seeking food assistance are requesting it for the first time. So that's also evident by the more than 40,000 searches we've had for food assistance on our website in the past month. So I'm going to stop sharing my screen now because I know there are other presenters, but happy to answer questions you might have at the end. Thank you.
Yeah, so Erica, just before you shift over for a moment to review the website that you mentioned, it's www.ntfb.org/wishlist.
Correct.
Yeah, and that helps people understand what the specific food needs are for the North Texas Food Bank in terms of food needed to pack the boxes for the families.
Exactly. Thank you.
And you're serving how many families per week?
Well, oh my goodness. Well over 5,000 families per week.
Okay. Got it. So, Sejal, I want to shift over to you. No pun intended there, because you're going to be talking to us about shift work. But basically, what we heard at the beginning of this pandemic was that the Communities Foundation of Texas was working together with the North Texas Food Bank to help move workers from affected industries like restaurants and bars and help them get jobs with the North Texas Food Bank and with other nonprofits that are seeing increased demand for their services during this time. Erica briefly mentioned that. Talk to us a little bit about shift work and how that partnership with the North Texas Food Bank and Communities Foundation and other nonprofits is working.
Absolutely. Thank you so much, Neil, for having me. And I also want to thank you and the Chamber for your leadership through this time. I've been watching a lot of the work that you all have been doing. So thank you to you and your board. The COVID-19 crisis obviously very severely impacted the service industry and put our already at-risk populations in desperate need of meals. And so, and in addition to all of that, we were also noticing that our nonprofit organizations that serve so much of this population were experiencing a spike in the need for volunteers to meet the escalating needs. What happened, however, was that the North Texas Food Bank and many other nonprofits, while their need for volunteers was going up, their traditional volunteers were not able to show up now because of social distancing and just health concerns. And so we, in partnership with the founders of the Get Shift Done, project, worked and again, in partnership with North Texas Food Bank and other nonprofits, created an initiative. This was in mid-March, and also to give kudos to another Indian American that I had the opportunity to work with on this, Anurag Jain, who is part of the Pro Jain VC firm, but also a chairman of the board of the North Texas Food Bank. He and Patrick Brand, who is the CEO of a technology firm in town called ShiftSmart, came up with this idea on a Saturday morning. They reached out to me on a Saturday afternoon saying, hey, we have this idea. Can the Communities Foundation be of assistance? And really what the idea was, it was simple and brilliant in a way, because what we wanted to do was connect these out of work restaurant workers with the very high needs that we were seeing in volunteer shifts that needed to be filled at nonprofits. So we set up a fund, a relief fund here in North Texas to support this, where we're basically bringing on these restaurant workers onto the ShiftSmart app, paying them now $13 an hour to actually fulfill the needs at these various different nonprofits. So we started off with the food bank. They were a wonderful partner. And then of course, as Erica mentioned, now the National Guard is in, but we're hoping to be right back at the food bank. But currently we're serving well over 30 nonprofits in North Texas and counting. And these restaurant workers are being paid to go and support the needs of nonprofits. So all the food that Erica talked about that needs to get out in the community, we're actually leveraging our restaurant workers so that they can get paid to go do this work. And so it's been an incredible partnership. We've raised well over $2.5 million. We have another $1 million pledged. We're continuing to raise money because the need is so high. And just like Erica mentioned, the interest for this project was not only seen by the North Texas community, but because of the press this unique project received, we have actually been working with the Get Shift Done team to take it national. So we've already started this in El Paso, Central Arkansas, and the Little Rock area, in Washington, D.C., the greater Washington DMV area. We're also working on, the whole West Arkansas region and many other communities across the country who have found this very innovative opportunity to support not only our restaurant workers, but also our nonprofits to make a difference. And so I hope that provides a good overview for now. But we also at the Communities Foundation have started about 5 different initiatives focused on COVID-19 relief efforts, and I'm happy to share more on that either later in the conversation or whenever you choose.
It'll talk to us a little bit about how the workers are supporting the various nonprofits, because sometimes there's a skills difference between what nonprofits need and what the workers may have. Talk to us a little bit about what types of roles are they serving in. I know Erica touched on the work at the food bank, but share with us a little bit more about how they're serving other nonprofits.
Great question. So something that we did very early on and are sticking to is the idea that we are focusing this entire effort on engaging restaurant workers who are used to working with food to work at food-focused nonprofits, right? So what we're doing very carefully is curating this because we know, and we've actually seen incredible productivity increases at these nonprofits as well. So for example, these workers will be deployed to assemble and organize food donations. They are prepping food and they're distributing or delivering food. And so it's all very food focused because we know that the core competency of these restaurant workers is to work efficiently with food, and the needs with the food-based organizations have been so high that we're trying to connect the dots, on this.
So now that helps us understand the shift work program, but I know that the Communities Foundation has been engaged in a number of other community initiatives. Talk to us a little bit about other needs in the community that CFT is seeing right now as a result of COVID-19, and then also how the North Texas community is organizing to meet those needs.
Absolutely. So kind of starting in early to mid-March, the Communities Foundation began to closely monitor COVID-19, both nationally as well as here in North Texas. And, much of the need at that time was unknown and it was evolving. And in a way, it currently still is. And so we focused our efforts to continue to prepare and support the nonprofits across our community. And we're continuing to monitor some of those specific needs. But one of the first things we did was to kickstart a North Texas Community Response Fund. This fund has raised upwards of $1 million, $1.5 million, through CFT, and many other foundations across the community also set up their own community response funds. But this response fund was really to provide the much needed support our nonprofits were going to need. One, because they had, many of them who had fundraising efforts planned were not happening now because of all the social distancing that was happening. The need, as Erica mentioned, has skyrocketed, with these nonprofits. And so we wanted to be able to provide a way to kind of create, provide some gap funding. So we started the North Texas Community Response Fund. I already talked to you about the Get Shift Done Fund, not only in North Texas, but other parts of the country. We also propped up, and this is happening on May 5th, of course, but, traditionally we run North Texas Giving Day, a large online giving extravaganza in September. But in order to support the significant needs of our nonprofits and our communities, we propped up in very short time, we're a partnership with North Texas, and we're calling it North Texas Giving Tuesday now. It's a partnership between the Dallas Cowboys, between United Way of Metropolitan Dallas and the Communities Foundation of Texas. It mirrors exactly what we do in September. It's an online giving campaign. You can go to northtexasgivingday.org, find your favorite nonprofit or favorite cause. There's over 3,000 nonprofits and many of the funds we've talked about that you can support with a donation online. And that's, we've already raised, close to $2 million so far, because donations are in. May 5th is the final day, so we encourage you to support that. But the other really cool collaborative that we started here in the North Texas region is something called North Texas Cares. And this innovative idea also found legs in many other communities across the country. That what this is a funder collaborative. So as I mentioned, many North Texas foundations and United Ways had set up their own community response funds. What happens when nonprofits need to apply to these is that they're having to go to every single nonprofit otherwise, and every single foundation, and put in an application. And so very quickly, we collaborated with well over 20 to 25 foundations across our community and said, let's have one common application. So very similar to a college common app, but we created a common application that nonprofits can apply to, and then all of the foundations across our community will be viewing this one application and making decisions on who to fund. They're also sharing information amongst each other. And so it's such a unique collaborative effort, again, that has received a lot of national accolades on it. And then one of the last other funds we did in conjunction with Judge Jenkins was the Dallas County COVID-19 Response Fund. And this was set up to provide frontline responders with the resources necessary to directly combat the spread of the virus. And so all of these things, if you go to cftexas.org/COVID-19, and I'll post this in the chat so all the attendees can view it, you'll find information on all of this that is going on in our community at that.
Awesome. Thank you, Sejal. That's so helpful. Sure. And thanks for all the great work you and Erica have been doing just to keep our communities up and running. We really appreciate that. So I want to shift a little bit and come to you, Sanjeevji. You are working with a group of others to spearhead initiatives on behalf of the Hindu American community, which is of course a subset of the larger Indian American community here in North Texas. And I know you've been doing some phenomenal work along those lines. Help us understand a little bit about what the Hindu American community has been doing to help during COVID-19.
Thank you, Neil. Well, in this time of when we are faced with such a different situation, we want to see how we can contribute some things while we are sitting at home as well, or with minimally going out. And nonetheless, Ege Mago he took a lead on it and talked, hey, how about we just go and have a lunch appreciation program for all the people who are in the front runners, namely our doctors, nurses, hospital staff, our police, communication, and our fire department as well. So, so that with that one, we made an appeal to the Hindu community to come together. And interestingly, almost 100% of the people we contacted via email or via phone, they responded very well and wanted to do something about it. So nonetheless, we did put a logistic team also, mainly AK Magoji, who was on the front end, me and Neil looking after contacting hospitals, fire department, delivery schedules, etc., etc. So with that, we have by end of next week, we are scheduled to deliver over 17,000 lunches at different times as well to various hospitals like Parkland, UT Southwestern, Baylor, Methodist, Presbyterian, Fire Department, police substations, Dallas Police Headquarters, and the Police Communication Department also, who we only call in terms of adversity, but they are behind the looking after our community as well. And we have so far been able to cover our cities in Dallas, Richardson, Garland, Plano, Frisco, Grapevine, and Mansfield. So, as I said, this is a great response that we got from not only the Hindu community, but then we approached many of the people who own restaurants also, how they can do it, whether they can subsidize or free it. And it was great that free food was given a couple of times a week from Genghis Grill, Kalachand from Hare Krishna. They have helped us with free food and subsidized food from Little Caesars, Sky Chef, and Subway. And our team of people have been basically going, getting the food made, get it delivered at the right time to the right places, because there are specific instructions on how to individually pack those foods. Some people can take pizza, but hospital cannot because of social distancing as well. And then at the same time, we thought about how we can help some of the foreign students, or especially Indian students also, who are in UTD, whose jobs or etc., like in the campus or outside, are a little bit in is not working at this time. So again, we are geared only to provide the hot food, or but logistically we could not do this where they could cook it. So then North Texas Food Bank came to rescue as well when we were talking to Anurag Jain. Not he helped us, but he took that on upon. And I think he has served so many people in UTD, as Erica has already mentioned as well. And just a side note, Erica, in case in this time you have too many, you need some extra storage or also for temporary, then we have some access to storage where we can, let's say, lend you for a month or 2 months as well, just to keep it going as well at no cost as well.
Thank you.
So with all this one, we were so thrilled that in this time of need, all the, not only the Hindu community, many other people have donated also. But it is just a great way for us to go and say, look back, appreciate our life, appreciate the things that we are blessed with, and at the same time to recognize the real heroes who are getting the patients who might be suffering back to them in their houses back and safe and sound as well.
Yeah. So,
And Neil has been, of course, she's being too polite right now, but she, apart from our full-time stuff, right, lots of hours go in the late nights and the evenings making all these sheets and trying to make sure that tomorrow's schedule is all done on right, and the people who are supposed to deliver, they get there as well without any disappointment as well. Thank you very much for, and I really, really want to thank not only our partners, like when you see all the good work other committees are doing and other organizations are doing, it is just a heartwarming that some things are beyond our business and beyond our personal good as well.
So Sanjeevji, talk to us a little bit about how it's working. So I know, so so the community has been providing funds. I know there are over 100 individual families that have come together to support. And then of course there are a number of Hindu organizations also that are supporting this. How is that support then getting turned into the meals going out to the first responders?
Yeah, the way we have collected funds, of course, through this time by check or PayPal, etc. And as I said, that we have almost 100% hit rate. Nobody has, everybody has donated, of course, different amounts available to them for this cause, but almost 100% hit rate for the people who we asked for.
Yes.
And then PayPal, etc. That has been the easiest one. Then those funds are basically collected, and we are giving some funds to, of course, some of the restaurants who are subsidizing the food at a great price. Along with that, as I said, that certain temples also, like DFW Hindu Temple, is serving directly to police department in Irving. So, and there is a restaurant owned by Hare Krishna community, which I did not know, like in a downtown, which is a great restaurant. So they are serving. So volunteers are coming there, preparing the food and individually packing. Ganges Grill is basically putting some boxes from different places, also from the different restaurants, combining them and sending it to Parkland or wherever Neil and I basically direct to them.
Yeah.
So that has worked very well with a number of volunteers along the way, and the community and the temples as well.
So, so I know that there are almost 15 different hospitals so far that have been recipients of the food. And I know that we've heard from some of those individuals who are like nurses, for example, who are serving in COVID positive units at, say, Parkland, for example. And because they're serving COVID positive patients, they're not going home to their families. Instead, they're going and staying at hotels. And so the food that we're providing is very helpful for them because they're not able to make lunches for themselves. They're not able to provide, dinner for themselves. So these extra meals that we're providing actually help take care of their meal needs while they are taking care of the COVID positive patients.
Yeah, exactly. And not only that, Neil, in just last week, we got a call from father of a nurse from, I think he was in California, so she works here in Methodist Plano, and he asked as a subway, they called us that, hey, can we do anything? Because once the nurses, they are disinfectant and they go on their job, they do not want to come out to go through that process again as well. So
Yeah.
it was great. So at least we were able to take care of not only one, but about another 100 people immediately on the spot to take care of this one. And so that has been enlightening also people's concerns, and also how people are coming forward to just go and serve as well. It just
Yeah,
is a
no,
good
it's
feeling working on this one. And Neil, you can add because you are with me on all the step, every step of the way as well.
yeah. I will just add 2 cents on this. It's been incredibly eye-opening to see the amount of logistics that has gone into uh, to not only serving these meals, but hearing the needs on the other end from the hospitals, the gratefulness, the gratitude we're hearing from the frontline workers and the first responders. We often don't think about the 911 dispatchers, for example, who work at police headquarters, but they're the ones who are fielding the calls, and they're online with the families who are panicking on those phone calls. So if we can help to take care of lunch for them during this time, I think that's really helpful because it's just one less thing for them to have to worry about right now. And even our fire departments, they're the front lines that go out with the ambulances, the EMS that then get the patients to the hospitals.
And
All of them are facing the brunt of this, and this is our small way of showing gratitude during this time, and just saying thank you for what they're doing, telling them we're with them and with their families during this time. And I know all of the meals have been going out with a note from the Hindu community that say that we're just so grateful, and I know that, and I know they appreciate it, as we've been hearing back from some of them. So
yeah, and Neil, it brings everybody together also.
yes,
Just in the like the selflessness can bring us all together.
Yeah.
At the same time, we are right now starting to explore different opportunities and ways that we can work with the North Texas Food Bank as well. So there is something that we are right now working on it. AKG is talking to NRAG as well. So over this time, probably we will be working something along with because the needs are different on there may be just a financial need only on the NTFP, or because on one side we are doing the cooked food, it doesn't mean we cannot do both of them at the same time. So that's
Right.
what we are exploring right now.
Right. Well, thank you for that. And thanks for all the work that you've been doing. I know you've been handling a lot of the food logistics, getting the food preparations, communicating with the various vendors and partners that are helping with this initiative. So thank you for, I know we've been having a lot of late night calls and trying to work through that, but I know it's a lot of great work. So thank you for what you've been doing.
Thank you.
So, Dr. Srinathji, I want to turn to Seva International. I've seen a lot of the great work that y'all are doing to support the plasma initiative. This has been a unique initiative that I've seen come forward from Seva International, and certainly one that's been much needed. And so, tell us a little bit about how the plasma initiative came about, and then also what it is, and then how people can engage with that with Seva International.
Definitely. Thank you very much for the opportunity. And it's wonderful hearing all the great stuff that all of you are doing, Sejal, Erica, and Dr. Kana. Okay, so here, Seva International, we are a, of course, 501c3, and we have 43 chapters across the US, and we are in 22 countries. And our work in the US is focused on multiple things during this COVID. Initially we set up 8 helplines, and we also have a 24/7 COVID helpline for plasma donation. Okay, and the idea came about that in Houston, we had a physician approach us, that a physician of Indian origin, Dr. Pranav Loyalka, who is a medical director at Methodist hospital there. And he said that, I have a patient on a ventilator looking for plasma. Can you guys see if anybody in the Asian Indian community can provide this, this plasma? So we started searching. We are a Hindu faith-based organization, and we, through our network, we started looking, and soon we understood that it's got to be very local because of the travel restrictions. So we were able to find a few donors, and fortunately, one of them matched. And there were a few false starts, and eventually the person was able to donate, and they had to physically go to the hospital. It's a 3-4 hour donation, and that set us off thinking. And Dr. Loyalka suggested that perhaps we need to broaden this, because I can see this problem coming. This is about nearly 4 weeks ago. And then, they are following the Mayo protocol with this FDA investigational convalescent plasma therapy. Okay, so we were able to quickly think about a registry, and along with a number of physicians of Indian origin, we thought that creating the registry, wherein in some states you only can donate to the blood bank. You cannot donate individually. A donor cannot donate individually to a recipient, particular recipient. So in those donors are able to donate directly to the recipient, it would be most helpful. So we created this registry, and we are a matchmaking. So what we do is the donors will self-register, as will be the physician or the recipient's family will do that. And once that is done and we find a match, then we put them in touch with each other and follow up to see whether the donor needs any rights, and so we provide. We have a fairly large, about 2,500 volunteers across, and we are able to provide them certain help. And then they would go in, and then the recipients, they have to go to the acute care facility where the patient is, and nearby are definitely there, they could donate. And some blood banks, local ones, allow that the donor to a particular recipient type of donation. So we are doing both the one-on-one type of thing and also one to the blood bank, plasma bank. So that we have about 80 donors who are registered. Of course, these donors have to be qualified. They have to, if they had any serious condition with COVID, they have to be 28 days away from it. And then they will have to have tested 2 times negative for it and have antibodies. Of course, the antibodies, they tend to, the half-life is maybe perhaps a month or so. So we just have a window, and it's not clear how long it is going to be, this half-life. So we need to get them as soon as possible. Those of them who have mild symptoms, they can get in 14 days they have 2 negatives, and they can provide the plasma. My background, I'm a professor in electrical engineering, computer science. They focus on what's known as systems biology, which is computer modeling of cancer. So a little bit familiarity with this kind of approaches. And so the team that we have put together, a whole group of physicians, software people, we have to ensure that our website is HIPAA compliant, all those kinds of good things. Okay, so we have also gotten requests that we want that such a registry need to be set up in India, because India may see its peak maybe a few weeks from now.
Sure.
By the ICMR, the local medical research council. So whatever that we are learning in the US can be transported to other countries too.
Yeah, and just so we understand the virtue of the plasma donation or the plasma drive, this has been one of the potential treatments for COVID-19 that has shown to be somewhat effective in helping a patient who is COVID positive recover by injecting the plasma of a COVID recovered patient, COVID-19 recovered patient's antibodies in the plasma into that new patient. Is that correct?
That's a really good description.
I think we're having a little bit of trouble hearing you, Dr. Srinath. You might have to come close. I'm not able to hear you right now. Okay, well, we'll come back to you on that. So I want to take a few minutes to open this up to questions. So we have just a few minutes left. And Dr. Srinath, if you're able to figure out why we're not able to hear you on your end, perhaps we can come back to you for a few minutes at the end. But I did want to take a minute to open this up to questions for everyone who's joining from the community. The Q&A box is open at the bottom of the screen, so you can just click on that and type your question in there. But I did want to ask quickly, so Erica, can you talk to us a little bit about if somebody wants to get involved today with the North Texas Food Bank, how do they get involved? What are the 2 or 3 best ways for them to engage directly with the NTFB's efforts to feed over 5,000 families a week?
Yeah, 3 easy ways. It's to give financially, ntfb.org, or participate in North Texas Giving Tuesday now on May 5th. Send food directly. And the best way to do that is through ntfb.org/wishlist. So that way you're providing us the food that's going directly into these emergency meal boxes. Or become one of our virtual volunteers, and we will equip you with pictures, with data points, with copy that you can share through your social media platforms. And you become a virtual volunteer through ntfb.org/volunteer.
Mm-hmm. Great. Thank you for that. Sejal, if people want to support an initiative that CFT is handling right now, just high level, top 3 initiatives that you would think that are worthy of community support right now with CFT to help during COVID-19?
Absolutely. So I've posted a couple of these. One easy way and very democratic way to support a cause that Indian Americans are passionate about, but where the needs are high, is to go donate at NorthTexasGivingDay.org. I've posted the link for that. If an Indian American actually has a restaurant or is a restaurant owner that is interested in getting their restaurant workers online our system, I would encourage them to go to getshiftdone.org. And then I'm also going to post, Erica mentioned North Texas Food Bank's virtual volunteer opportunities. We've included hers as well as a whole list of various other virtual volunteer opportunities across our community in this time of need. And so I'm going to post that link on the chat as well. And this is just a way for Indian Americans, their families, including kids and elders, can be a resource at this time. And many already have stepped up, and I do want to thank them for it. But the link I provide will be helpful for that.
Awesome. So Sanjeevji, if individuals want to donate to the initiative, and I know that the donors started off as Hindu Americans, but now I'm seeing many members of the community who are interested and excited about what I know we've been working on. If they want to engage, how do they donate to this cause? And then I have a follow-up question to that. So, but first, how do they donate to this cause?
Yeah, right now, I think we just approach our friends within our close circle or so, and it kept expanding as the people were coming, but we did not create any website or anything for that one as well. Yes, it is through Global Hindu Heritage Fund that Prakasha Raoji manages it. So we are taking advantage of their 501c corporation to do this cause, right? So we don't know what the future would be, what the needs would be. So it just started as a thought on the dinner table, and just basically we are up to 17,000 meals. So we do not have any per se website made for Hindu community. It was just a thought that came, and but it is through Global Hindu Heritage Fund.
So if they want to donate to the first responder program, though, they can go to the ghhf.org website.
That's correct. That's correct. So this is the website, that Global Hindu Heritage Fund.org.
So they're partnering with this initiative on that effort. And I know there's a link there where they can click on first responder, and then that will directly help us to see the funding that's going towards the meal programs.
That's exactly, the link is made just for this cause temporarily.
Exactly. Awesome. So a follow-up question to that, we probably have a number of Indian American or Hindu American owned restaurant owners as well, and other restaurant owners. They don't necessarily have to be Hindu American or Indian American, who are working to provide these meals at, like you said, a very, very low cost to the community's effort. If other restaurants want to help in this regard, how do they engage in that process?
Oh, basically, just you can go to the same website, or just send us a note. Send a note to me or Neil or anyone as well, between 3 of us, or AK Magoji. We will get you started on this one, whatever this. And it seems like probably from next week or this Friday, things, once they open up, we will see what the extent is. And I keep my fingers crossed that everything starts to get normalized over the next couple of months as well.
Yeah. I think we may have lost Dr. Srinath. I'm not seeing him here. But I think he has pasted the Sewa International link, which is sewacovidplasma.org here in, oh, he's back on, it says, okay. He's posted this link here. It's www.sewacovidplasma.org, and we'll make sure that those links get sent out after this call. But this is a great place. If you know anybody that is that has been COVID positive, has tested negative twice after being COVID positive, and then is interested in having their plasma donated, this is a great place to just contact them and get that information out. And I know I've seen a couple of physicians actually who have tested positive for COVID, and Seva International has pushed out those initiatives to help find matching donors for them in their communities. And I know one of them was successful in finding a match. So I think, given that, given just the widespread of this virus, unfortunately, this is a great way to help our community. So we're coming up right on the end of the hour. We have just about a minute left. I don't think we have any additional questions right now. So I just want to say thank you so much for everything that y'all are doing in the community right now. It's been such an interesting time to live through, but I think what has been tremendously heartwarming to see is just how the community in so many different ways is stepping up, coming together. People are rising to the occasion to meet the needs of the hour. And I think that I know all of you are a part of that effort, and I want to thank you. And if there's anything that the Chamber can do to support the initiatives that you're working on, or if there's anything that I can do to support the initiatives that you're working on, please don't hesitate to reach out. We want to be here as a community to make sure that all of our members of the community are taken care of during this time. So with that, thank you so much. And a recording of this video will be made available. If anybody who has joined us today is interested in reviewing any of the parts of this webinar, we will make that recording available to everyone at the Chamber's YouTube channel. That is, you can go to YouTube and just search for USICOC DFW or US India Chamber of Commerce Dallas Fort Worth, and all of our videos are available there, as well as all of our programs actually over the last several years and in some cases even decades. So you can find all of our content there, and especially a recording of this video today. So with that, on Friday, we have an education webinar at 10 a.m., STEM, computer science. So for parents who are trying to figure out what to do with their kids during this time while they're homeschooling, we have some STEM information, STEM education activities and information for parents. And then also our partners at the Dallas County Community College District will be providing a workforce development overview. So please keep an eye out for that. That's on Friday at 10 a.m. And then next week we have some additional exciting programs. And for a lineup of all of our programs that come out on a weekly basis, you can sign up for the Chamber's newsletter at www.usicoc.org. That is the Chamber's website. You can sign up for our newsletter there. And every week, about 2-3 times a week, we send out information about upcoming webinars and information related to COVID-19, as well as resources for businesses to access during COVID-19. And we have a COVID-19 specific newsletter that comes out every Tuesday, and our regular newsletter comes out every Thursday. And then, of course, updates about upcoming webinars come out as needed. So keep an eye out for that. We don't mean to spam people during this time, but the information is extraordinarily relevant to a lot of our businesses, so we are trying to make sure that they get it. So with that, I want to thank all of you for joining us today, and thank you for all the work you're doing in the community, and stay safe during COVID-19. Thanks so much.
Thanks, Neil. Thanks,
Thank
Erica.
you.
Bye. Thank you.
Thank you for having us. Thanks.
Thank you. Thanks, Dr. Srinath, as well.
Yeah, bye-bye.